Welcome to Professor Dr. Siddharth Das, who is the co-founder of the Society of OA Research. May I request, Monica, could you please felicitate sir, please?
আকাশ ভরা সূর্য তারা বিশ্ব ভরা প্রাণ তাহারি মাঝখানে আমি পেয়েছি মোর স্থান বিস্ময়ে তাই জাগে আমার প্রাণ আকাশ ভরা আসমান सूर्य चंद्रमा विश्वमय प्राण उसी के बीच में मैंने पाया मेरा स्थान भूचकित और नए जगे मेरे प्राण भरा आसमान অসীম কালে যেহিলোলে জোয়ার ভাটায় ভুবন দোলে युगों से जिस लहर में जोआर भाटे में धराई झूले नारीते मोर रक्त ধারায় লেগেছে তার টান ভূচকিত और नए जगे मेरे प्राण भरा आसमान सूर्य चंद्रमा विश्वमय प्राण उसी के बीच में मैंने पाया मेरा स्थान भूचकित और नए जगे मेरे प्राण भरा आसमान धन्यवाद
Thank you, Sushmita and Sriragna. May I request the dignitaries to come and light the lamp, please? Sir, lamp lighting.
Okay. D'accord.
May I request?
Chalo. Bolo.
Dr. Mukul Bhattacharya, Professor Jyotirmay Pal, sir. Can everyone please come and light the lamp, please? May I request Professor Mukul Bhattacharya to release the souvenir for SORCON 2025, please? And can everyone take a copy of the souvenir? Uh, Moving on, may I request our chief guest, Professor Mukul Bhattacharya, to please come and say a few words.
Good evening, sir. Respected dignitaries on the dais, our teacher, Sir Shukumar Mukhopadhyay, and Parashar sir, Alokendu sir, distinguished guests, esteemed faculty, researchers, clinicians, and dear delegates. It is with immense pride and great pleasure that I welcome you all to the 7th National Conference of the Society for Osteoarthritis Research in India, held in collaboration with the West Bengal branch of the Indian Rheumatology Association and hosted for the very first time in the culturally rich and academically vibrant city of Kolkata. As the Vice Chancellor of the West Bengal University of the Health Science, I feel deeply honored that this prestigious academic congregation is being held under the aegis of our state, which has historically contributed significantly to the fields of medicine, medical research, and public health. Osteoarthritis, once thought to be merely a degenerative disease of aging, is now recognized as a complex disorder that impacts millions across the globe, affecting mobility, independence, and overall quality of life. With the growing burden of non-communicable diseases in India, musculoskeletal disorders, especially osteoarthritis, demand not only our clinical attention, but also robust research, innovation, and policy engagement. This conference is not just a meeting of minds. It is melting pot of new ideas, emerging technologies, translational research, and multidisciplinary collaboration. I'm confident that the deliberations over the coming days will inspire new insights into disease mechanisms, novel diagnostic approaches, and advanced treatment modalities from regenerative medicine to community-based interventions. I congratulate the Society for Osteoarthritis Research in India and the Indian Rheumatology Association West Bengal branch for their visionary leadership in organizing this event. To the young researchers and students here, I encourage you to make the most of this opportunity to learn, to question, and to innovate. For it is through your curiosity and commitment that we will chart new frontiers in osteoarthritis research and patient care. Once again, I welcome you all and wish the conference great success. May your deliberations be insightful, your exchanges fruitful, and your stay in Kolkata memorable. Thank you. Jai Hind.
Thank you, sir, for your kind words. May I request Professor Sukumar Mukherjee to say a few words, please?
Good evening, our Vice Chancellor, West Bengal Health University, Dr. Bhattacharya, our good old friends, Dr. Ravindran, Dr. S.K. Das, and all the rheumatologists of the different parts of the country, friends, postgraduates, students. This is a great opportunity to be here to share some thoughts about the changing dimensions of the management of osteoarthritis. And this is a monothematic conference instead of a multidisciplinary conference, where just we have finished last week. This is a monothematic conference. I was just thinking, this is a prerogative of the Orthopedic Association, dealing with osteoarthritis mostly. And you know, if you take stocks, all over India, knee replacement has become in epidemic form. And that is why in this conference, what is the new dimensions, that is very important. I would call, instead of a paradigm shift, it is a pendulum shift. And pendulum shift from one end to other, who will be treating osteoarthritis in 2050. Multiple partners in the therapy of osteoarthritis, orthopedic surgeon, physiotherapist, physician, rheumatologist, or even anyone, general practitioner, because this is such a common disease in daily life all over the country that everyone has got the access to the knee pain. And rising obesity, rising metabolic syndrome, rising diabetes, and many other metabolic disorders, osteoarthritis go parallel to that. And that is why there are multiple partners in the therapy of osteoarthritis. So I think all of us must be armed with good knowledge what is happening. When we were a student in medical college, osteoarthritis is mostly treated by orthopedic surgeon medically with some pain-killing drugs and little bit of physiotherapist. And the people accepted osteoarthritis is their life till death. Nobody cares to continue the treatment, invasive treatment, what we are doing today. Today, there is a pendulum shift, and pendulum shift, medical treatment, CAM, alternate treatment, physiotherapy treatment, rheumatologist treatment, and orthopedic treatment. So obviously, we have to change with the change in time. And medical science is always ever changing, and that's why the change in thought in osteoarthritis is also taking the limelight. And that's why we have all collected here from different parts of the country to show what is the new things going on in the osteoarthritis and how and why, when and how the patient should be treated. And it is also confusing. Many people have got rheumatoid arthritis, psoriatic arthropathy, many other arthritis. And osteoarthritis may be a silent spectator, may not be obvious unless you search for it, unless you have got a probe in the mind to look into it. Osteoarthritis may be silent, may be symptomatic, may be a part of life, of old age. And now we are all aging. Aging has increased, so more you are going to meet patients with osteoarthritis with the age above 90, 100, even more than 110. So obviously we must be armed with all kinds of knowledge how to deal with osteoarthritis in the early age, below the age of 40, above the age of 40, 50s or 100, whether you are justified to treat osteoarthritis in a patient of 100 by any kind of means, or this is a part of life. That is the decision, and that has to be taken by the physician in charge, how to treat it, when to treat it, and how we are going to treat it. So obviously this conference may throw some light about the newer changes or newer dimensions in the thinking, whether it's a degenerative disorder or it's a metabolic disorder or it's an inflammatory disorder. Even the neurologists have come because of neuroinflammation, and neuroinflammation is also a basis. So whether neurologists will treat, that remains a vexed question in near future. Whatever may it be, we must have some kind of informations, newer informations about osteoarthritis, early detection. Can we prevent it? That is most important part of our lifestyle. And that is the important in this case. Treatment is so varied. You will get the television. In the television, there are a lot of applications, a lot of oils and everything, and those lot of pictures. And these are tempting pictures for all kinds of people to treat osteoarthritis by various. That's why the CAM has come. And the CAM are particularly treating osteoarthritis in many, many ways. So obviously, we are in the controversial, disputed position, how to treat it, how to treat it, and what drugs should be appropriate in such circumstances. I'm sure this conference will give us a summary for the eligibility of treatment, what sort of treatment is appropriate, and how costly, because on the horizon, knee replacement has opened the floodgate, and that floodgate, whether can you control it by your medical means or not, that has to be seen. Obviously, this conference may throw some light in near future about the direction of treatment of osteoarthritis. And that is my plea. And we have seen osteoarthritis in the young age, and today more than 40 years or 50 years or 60 years, a lot of changes taking place. Let us align with it, let us adapt with it, and let us go with it so that we can dissect out to find out what is the appropriate treatment in the right age. And that is the message we should carry on. Thank you very much for giving me an opportunity to talk.
May I request Dr. Kiran Seth, the Secretary of SOAR 2025, to please come.
respected dignitaries on the dais, esteemed faculty and delegates, and my dear colleagues and friends. So the West Bengal chapter of Indian Rheumatology Association is very successfully carrying out the conference, 7th annual conference of Society of Osteoarthritis and Research. So this year theme, Soaring High with Osteoarthritis, perfectly captures our mission. Sir has really talked a lot about osteoarthritis with the paradigm pendulum shift of osteoarthritis, the treatment, the disease, every facet, multifaceted disease like is now being explored with multiple specialities as we are seeing. It is just not a slogan. It is a commitment, a vision, and a call to action. So it is not just a wear-tear disease of aging. It is now the top causes of disability worldwide. 60 million people, yes, 60 million people are affected, and many of them in their most productive years, and yes, a majority of them are women. Osteoarthritis remain under-recognized, under-researched, and far too often under-treated. But here the SOAR comes and steps in. We are creating the interest, and let me tell you friends, whosoever in this room, today we as a secretary has an offer because we are going to increase the registration fee for to become a member from 5,000 to 10,000. So in the next 2 days, like whosoever wants to become the member of this society will really be benefited. I really want younger brains to come and work for it. I want to take a moment to thank the wonderful organizing team of West Bengal of IRA for their vision, their energy, and their dedication. Your efforts have brought us all together for what promises to be an exceptional academic and networking experience. Over the next 2 days, let us challenge assumptions, ask questions, and learn from each other, whether we are talking about early detection, rehabilitation, regenerative therapies, or improving access, better patient care. Let us soar, not just in knowledge, but in our compassion, our commitment, and our collective spirit. So it is rightly said कि मैं अकेला ही चला था जानिबे मंजिल की ओर. So this, our sir, Dr. Siddharth Das, who is the father of, of SOAR, अकेला ही चला था जानिबे मंजिल की ओर, लोग आते गए और कारवां बनता चला गया. Thank you so much. Thank you so much.
Thank you, ma'am. Lastly, may I ask Dr. Bishwadeep Ghosh to please come and give the vote of thanks.
Good evening, everybody. This conference, this gathering, these programs of 2 days, all are beyond my expectation. Thank you all. Thank you, my colleagues, my students, the organizing team, the pharmaceutical companies, the event manager and his team, everybody, and the honored guests sitting here. I thank you all. I thank you, our WBBIRA office bearers, our patients who are our inspiration. Thank you all. And welcome to the next program, our gala dinner. Rashmi.
Thank you. This marks the end of our inauguration ceremony. Please stay back because we have a very exciting session coming up next. We have a musical session by Snigdhijit, and I would request you all to stay for it, please. May I request everyone to stand for the national anthem, please.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मागे गाहे तव जय गाथा जनगण मङ्गलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Check.